Welcome. We only have 30 minutes, and it's a critical topic of worldwide and literally epidemic proportion. You already have the biographies of this terrific panel. For those of you watching this live stream or later, we welcome Dr. Mauricio Hernández, the director of the National Institute of Public Health in Mexico, Mayor Greg Fisher of Louisville, Kentucky, and I'm delighted she wasn't on our program before that we were able to draft Linda Gibbs, Deputy Mayor of Public Health and Human Services in the City of New York. Should have had her all along. And sadly, Dr. Tom Frieden, Director of the Centers for Disease Control, could not be here because of the government shutdown. The very fact that I have to say something like that is frankly still shocking. Our topic is slimmer cities, promising strategies for fighting obesity. Obesity is perhaps the leading public health threat in America today, cities and countryside alike, and it is spreading globally. Its toll is huge. Obesity doesn't necessarily kill as directly and as insidiously as does tobacco, but it leads to diabetes, heart disease, many forms of cancer, arthritis, pulmonary diseases, and countless other costly and debilitating problems. And of course, it greatly diminishes the quality of life of those who suffer it. And we have an astonishingly high percentage of people who are obese or seriously overweight, and including populations, cultures, and cities where until recently obesity was not a serious problem. We have many people here from around the world, and in many countries obesity is viewed as a deadly American import. It is also an especially challenging problem because it is so multifaceted. Unlike tobacco, as difficult, and we had a wonderful breakout on this yesterday, as challenging as tobacco reduction in smoking is, obesity is far more complicated because there are so many other factors that are involved than simply, say, smoking a cigarette or eating a particular item of food or drinking some beverage. The physical environment is critically important, whether it's sidewalks, playgrounds, bicycle lanes. We've been hearing a lot about this at this conference, parks, even things like physical education availability in schools, youth leagues. All of these things are a factor. The food environment is obviously also critical. The availability of fresh fruits and vegetables, food deserts, the presence of junk food or sugar-sweetened beverages, placement of these things on shelves, how they appear in schools and around the community, marketing to children especially, social and cultural norms, images and networks, and even businesses and the practices that we're all used to affect this in some way. You know, whether the default for meetings or conferences in our own places of work are jelly donuts or the kinds of fresh and healthy options that we have here, and I want to commend our organizers for that. So while all of these many factors make the problem a more complicated and vexing one, it also gives reformers and public health activists, and especially mayors, many tools and levers to use. So what we're going to talk about today is what actually works and what lessons have been learned. And I'd like to start with Mexico, again, because we have so many people around the world, and this really is a global problem. For those of you who don't know, our neighboring country has a diabetes rate of almost 11%, which is higher than any other country in the OECD. The UN just reported that close to 33% of Mexicans are obese, which is the highest of any country in the world with more than 100 million people. And not coincidentally, Mexico has the highest per capita consumption of sweetened sugar drinks in the world. But the new government of Mexico is not only taking this very seriously, but there seems to be some promise that Mexico will be the first country, as I understand it, in the Americas to enact a soda tax. Can you tell us about that and its prospects?
Well, thank you, Adam. Yes, we've been working since many administrations back trying to push a soda tax with the view that if we change the environment, people will be able to make more adequate decisions regarding the choices of what they drink or what they eat. So this soda tax has this purpose. If you take a review of our tax reform, you will see that this tax is rooted in public health research, and all the work that it has been done nationally and internationally. This is a major issue because we have not had any tax in Mexico, well, probably except tobacco, that was hard to pass, that was linked to a health outcome. So how we managed to push this tax? Well, we make a connection between the sugary consumption beverages and the incidence of obesity, and then to the incidence of diabetes. So we were able to show what will be the savings in terms of health, the health gains.
So do you think it's likely to pass?
Well, sugary beverage industry is a very powerful industry, has a major lobby.
I think Vicente Fox, wasn't he president of Coca-Cola Mexico before he was president of Mexico?
Yeah, he was, but I guess now we have much more evidence of what sugar beverages are doing to our health.
What about the argument that we hear too, very often, that taxing sugared beverages is regressive? It is a high burden on poor people. What's your response to that?
Well, at the end, when people make healthier choices, they win health. So at the end, you are preventing diabetes, you are preventing obesity, and this is something which is also concentrated in poor neighborhoods, and so at the end there is a health win. We are hoping that this tax is going to be connected to providing drinking quality water to a larger proportion of our population, and if we connect those two, then definitely it won't be regressive.
Yeah, someone said not too long ago that the incidence of diabetes is regressive too. So, but you make an interesting point about the availability of water, and even in many places in this country, fresh water, drinking water, is not as readily available for people, and it's especially, I think, a problem in the developing world, where in many cases people choose these sugar beverages because water isn't safe to drink. So that sounds like it's an important lever in Mexico, just making water more available.
Yeah, well, if you can bring a Coca-Cola any place in the world, you can bring a bottled water any place in the world. So I mean, I guess right now we don't have any problem of making water available.
What are some of the other levers that have been especially effective in Mexico as public health measures to affect your obesity epidemic?
Well, we don't have a long-term evaluation, but in Mexico we have focused our actions in moving away from this issue that obesity is a self-responsibility. We're moving to actions that are trying to change environment. So we are changing the school environment, we are changing the environment in the streets. If you go now to Mexico City, you will see there are bike paths all over the way, that the streets are closed on Sunday. So there's a lot of things that are pushing activity. On the other hand, we are also trying to make our neighborhoods more safe so that people can do more physical activity. So we are focused mostly on environment. We have also done some modifications to our school curriculum to promote nutrition literacy in our children, in order to increase the likelihood of that they take better choices. We have not been very successful, for example, in labeling menus, which is a very, I think, effective way of changing behavior. As you see here in New York, you arrive to any food chain and you see the calories and you can make your decision in terms of what you eat. In Mexico, we have faced an enormous resistance from industry to go into labeling menus or providing an informative front labeling package.
Or maybe you can learn from the successes we've had with labeling here, and we can learn from how you're able to actually tax the sugar beverages, which has been a challenge throughout this country.
That's all this meeting about.
Let's move to Louisville, if we can. A city where I read that 6 in 10 of metropolitan Louisville are considered seriously overweight, and in a state that is ranked 7th in the nation for obesity. Yet the New York Times recently featured your city mayor in a story, "A City Tries to Slim Down," and it's a fascinating and an inspiring story. Can you tell us the essence of what the strategy is in your city to attack this problem?
Well, we know to be competitive as a city in the 21st century and have a healthy workforce, we have to have a healthy city. So 3 core values guide our city every day. One is lifelong learning, which ties into the innovation theme of yesterday. an even more compassionate city, a city where, friends are helping friends, strangers help strangers. And the third is how can we be an even healthier city? So with that, it's physical health, mental health, environmental health at the same time. And underneath that health panel then, we focus on issues like policy, access, activity, and nutrition. And so we're talking about this every day in terms of putting that front in mind with people. Most people, we have something called the Mayor's Healthy Hometown Movement that details all this out, and a lot of people associate that movement with these large displays of physical activity that we have. 10,000 people showing up on our waterfront park to cycle through downtown streets that have been closed. 500 people doing yoga on the park, or Tai Chi, or paddling in the Ohio River. So our focus is get out, be active. You don't have to look like an athlete to start being active. And that's really the hardest step with people that are obese, is to get them out of their cell and say, okay, I'm going to start down a new path in my life. So we try to encourage that in many ways.
So how have you gotten such incredible community buy-in to these efforts? I mean, it does seem like you've been more successful than many other cities.
Well, when you have these large displays of people showing up, literally thousands of people, then folks say, well, if Joe can do it, I can do it. And you see that with people bringing their friends or relatives to these events, so they just get out and about. So I think that's part of the display, and then a lot of it's communication as well. We talk about it a lot with nutrition as well. We have a very active locavore or local food movement in our city, which led us to asking the question, how much local food do people want to consume? So we did the first demand study for local food in the country, and we found that as Louisvillians, we're about 750,000 people in the city, 1.5 million in the metro region. We consume $2 billion of food a year in our city. And of that, $300 million is what we call local food, or local nutritious food. And there's a demand for $800 million, which was our learning, because we're trying to be an intermediary between the farmers and the consumers. And interestingly, in that study, we found, because a lot of people feel like local foods, farmers markets is kind of a upscale type of thing, but there's demand for good, local, healthy, fresh food from all socioeconomic patterns for the same reasons. One, they want to help local businesses, in this case farmers, and two, they see the product as a higher quality, fresher, more nutritious product.
Have you done anything with the independent school district? I mean, how have you worked with the schools in this area?
Well, in a real positive way. They've made a commitment to our local food component in terms of the percentage of their menu. It's 10% right now. They've reduced the sugar and sodium components in their foods. We've increased the number of kids that are having breakfast at school, so they start off with a good, healthy meal at the beginning of the day as well. So, and then they're also a member of our Health and All Policies team, where we take a look at all the policies that we have in the city from a holistic view, from transportation to education to agriculture, and say, how can we be a healthier city?
Thank you. And Mayor Gibbs, New York has been incredibly ambitious in this area, has caused some firestorms along the way too, with, for example, the portion cap rules. We had a conversation yesterday in one of the breakouts, remembering how when we used to buy Coca-Cola, when at my age, it was a 6.5 ounce bottle. You put the nickel in, it was 6.5 ounces. Now they're available 64 ounces. But even with that defeat, we may come back to that, the reduction of sugar drink consumption has gone down dramatically, and New York is now a model for so many things. We've talked about bicycles, parks, or everything else. What do you think have been the most important levers that have made a difference here in New York?
And we're not done yet. We're actually waiting to hear whether or not our appeal will be accepted on the soda size
Good luck.
cap. Yes, exactly. Thank you, everybody. I think with our strategy in the city, one of the unique things, and I hear it in both Mexico and Louisville, is that as a critical public health issue, for instance, now obesity is about to surpass cancer as the leading cause of preventable death in the city. It'll be number one. And what the mayor, who is obsessed about metrics, as you've heard, what he really challenged us to do was to look not just at our public health agency for answers to this problem, but to get all the city agencies together. And so he asked me and my colleague Kaz Holloway, who's the deputy for operations, to head an obesity task force and to really try to think about across all the agencies what we could do. What came out of that was a 26-point plan that focused on reducing bad food elements in the environment, increasing good stuff in the environment, increasing physical activity, and really a special focus on children. And so out of that came unlikely partners in some ways. Who thought the Department of Environmental Conservation was going to be a big player in our obesity task force? But guess what? They got a lot of water. And so not only bottled water, but putting up pop-up water fountains around the city. You'll see them all, all the time in the parks and along places where people are exercising. Our schools, we adopted nutrition guidelines for the city, and the schools were the first out of the gate. In fact, the schools had started to do this work before the obesity task force and the nutrition guidelines were created. And so ensuring that all the school meals that we serve are according to a certain calorie and nutrition standard. Putting salad bars in virtually every school now has a salad bar and water jets so that kids can fill up their cups, refill their cups with water. And so by doing this, by reaching out to all of the partners and saying this is a shared goal we have for reducing obesity in the city, we both were able to give a train for agencies to hook their car onto. And a great example of that, at the Department of Design and Construction, they were working on active design guidelines. What should a building look like in order to promote physical activity of folks who are in that building? Open up stairways, create walking paths, encourage people to move during the day. The commissioner was like, amen, hallelujah, now I have somebody to sort of carry my initiative along. And then in other cases, it was sort of that permission giving that was provided to agencies to sort of scratch their heads a little bit and say, are there things that I can do? So our Department for the Aging, and in many ways working with folks like city planning and transportation, said, we need to provide safer paths for elderly New Yorkers to walk. And so bringing those shoulders into the streets so that the crosswalks are more narrow, changing the timing on the lights, and to think about safe walking passages. Now, where do we stand with all this? We're a good ways in. Not everything is off the ground yet, so many of these things are still being implemented. Our most recent data just came out. Adult obesity ticked up again. Child obesity, on the other hand, we're seeing now a 5-year trend downwards. And now, I don't want you to see like a steep slope with the ball rolling at a gazillion miles an hour down the hill. Maybe it'll roll downhill. It's like a little tick down, but it's 5 years in a row now with kids. And that's unique. That is bucking the trend nationally and internationally. And so that's, I think, very promising, and there's some glimmers of hope there.
Well, congratulations on that. Just one general question, and then we'll open it up in the minutes we have left. When I think, you've all been at the vanguard of public health efforts, and you think about some of the arguments, and well, first of all, you've also touched and used all these levers that have nothing to do sometimes with regulation. But on regulation, when you think of the other major public health campaigns of the century, whether it was seatbelts 40, 50 years ago, smoking, the arguments that were used were about freedom. It's my freedom not to put on a seatbelt. It's my freedom to smoke. And you hear the same things now. It's my freedom to choose to eat as I do. And then these slippery slope arguments. Well, if you tell me I can't drink out of a 60-inch, a 60-ounce glass, you're next going to tell me I can't eat chocolate or I have to eat broccoli, and it's my basic American freedom is at stake. But we overcame those issues with seatbelts and tobacco. Are we going to overcome the same issues with obesity?
I think that it is a battle. We've not been successful. For instance, we're fighting for your cause. Maybe after the end of the administration, I'll come down and carry placards for you and do what you can to get the soda tax passed in Mexico, because that would really be a great accomplishment, and I am sure others would follow. But we need a first, and we were not successful here in New York. Thus far, we've not prevailed on the size of the sugary drinks. I think there's a combination and a balance. You try to think about how, as a government, you can provide information and persuade. We spent a lot of time and effort on like subway and bus platform very graphic depictions of the consequences of drinking too many sugary beverages. And so just try to raise the public awareness and counter all of the advertising that's in the environment that, suggests, how much happiness you'll get from doing this. And so we do that, but we know, and really the tobacco history is our lesson giver here. We know how incredibly powerful increasing taxes are to behaviors, and we know information helps, but it isn't the most powerful behavioral lever that you have. And so more aggressive actions that we can take are really needed in the face of an epidemic that is causing just tremendous social burden on individuals and great social costs on us as a whole, as a society.
And, I do think when you take a look 10 years back, the progress that's been made has been huge. So we're at the very beginning of this journey, and we find out that, place matters. So the data now is overwhelming. Like in a city like ours, in most every city, if you live in one part of town, your life expectancy is 68 years old. If you live in another part of town, your life expectancy is 82 years old. So there's a social justice movement that flares up and says, hey, what's that all about? And when you start drilling it down and you find out that obesity might be one of the issues behind that, then the next question is, what causes obesity? What can I do about that? So a lot of it's education and knowledge that I think we're at the beginning of what's going to be a strong movement as we get into more and more talks about health insurance. Obviously, there's a little conversation about that right now. And cost, we're going to see this be a positive thing here in the near term.
Okay, we just have a few minutes. It's hard to see hands, but I will do my best. The woman over here, I think we need to wait for a microphone. And if you just give us your name and quick question, please.
Yes, Diana Quintana from Mexico City Department of Transportation. Just wondering if, this goes obviously to Mauricio, is there being work done on the relationship of the built environment and public health? It's a discussion that's been tapped on in many places, but not in Mexico particularly, or at Latin America in general. There has been some of this been going on in Bogota, but it's one of the few cities in Latin America where I've heard that they've started to link the relationship between the built environment and public health. So I was just wondering if this is something that right now the National Institute of Public Health is currently thinking as a means to start promoting, the biggest barrier for active lifestyles is the fact that our cities are not built to walk and too much priority is given to the car. So the biggest barrier for healthy cities is the reallocation of this street space for healthier lifestyles.
Thank you. Indeed, it's going on. The problem in Mexico is that this knowledge is still within the health sector, in the sense that if we stop operating like silos and we move from sector to sector, then we can link with the transportation sector, security sector, with the social sector, and then connect health with security. As you might remember, we have done a major effort to recover all parks, but this was mostly an issue of security. The link between health, exercise, and recovering these parks was not made. So we need to move to that step, which was already mentioned, is health in all policies and interconnect. And then we will get the message that the built environment is really a strong determinant of our health.
Thank you.
If I could just add something on that.
Please, Mayor.
This series has been focused on mega cities to a certain degree. So most cities are like ours. We're 1.5 million metro area, not real dense. So you don't have as much public transportation, as much walking that's taking place in a city. So just making cities like ours more walkable and bikeable is a major focus of all U.S. mayors right now.
Thank you. Let me go over to this side, please.
Hi, I'm Diana Silver. I'm from New York University. And you've talked a little bit about physical activity and about food and some about sugary drinks. But the other piece of obesity might be also thinking about alcohol. And we haven't done very much in this city, at least, about even basic information about what the calorie content is in alcohol. And yet we know that alcohol consumption in the last 10 years is, went up pretty dramatically. So I just wondered if alcohol is off the table, because it might be even a more scary industry to approach, because you have a bunch of, not only just the alcohol industry, but you have hospitality, or if it is on the horizon as another place to think about intervening.
Who would like to take that?
Yeah, part of the answer is you got to pick your battles. And we looked at the issue of alcohol consumption. It's and sort of beyond obesity. It's funny when you're talking about substance abuse. You know, the first thing that pops to mind is not let's try to do more because of obesity, because there are so many terrible social ills that come from it. But I will, you know, just in thinking about how to go about the sugar-sweetened beverages. Controls, you know, it's you know, how complicated do you want your message to be? What's the cleanest, clearest path? You know it's going to get litigated, and so part of it is definitely weighing all the pros and cons and picking the battles. I think that I cheer on the next administration here in New York to sort of finish the soda battle and then sort of expand it and take that on. It's I agree with you.
If we have one quick question, maybe in the middle, if there is one. Yes, right here. Last question.
Ewan Robertson from Mars in Toronto. This conference, of course, has been about cities, and as we know, cities are globally connected, and where increasing amounts of the population are concentrated. So I wanted to ask a question about pandemic preparedness and what cities are doing, or what the views are about how cities can be better prepared for that critical public health threat.
Pandemic preparation.
Well, that's on the side of the health sector, as in Mexico at least, a type of coordination, and we work very much with all the cities so they can develop their plans. We had a big lesson in Mexico with H1N1 that show that we have a very good coordination between the federal and the local government. So all cities must be prepared. Is certainly an issue. We've seen it in the last year with China H7N7, and we'll be seeing it. So cities must be prepared for that.
Here in New York, we have a wonderful syndromic surveillance system where we get real-time feeds from the healthcare delivery system around what doctors are seeing. And it's actually the outbreak of H1N1 in New York City. I so clearly remember, I'm sorry I'm not Tom Frieden, that he wasn't here with us this morning, but I remember when he called me on a Friday afternoon, and he's like, I have to shut down the pageant at the high school. And I'm like, what? You can't do that. Grandparents are in from out of town. And he's like, no, we've seen this cluster, and we can't explain it, but it's a serious cluster. And that, you know, that turned in 24 hours to be the epicenter start of the H1N1 virus. So having that kind of surveillance system and a set of protocols that is a close interweaving private hospitals, public health, and public safety, and protocols around how to do that, and using your Office of Emergency Management. We've got sort of plans that are exercised so that when that event actually happens, people not only have a plan to turn to, but they've given it a couple dry runs. You'll hear every once in a while in New York, you know, don't be upset tomorrow morning when you go through Union Station, you know, we're planning a mass something exercise, and there'll be bodies, but they're not really dead, they're just like, you know, acting dead, so that we can go through these exercises.
And with that, I'd just like to thank this wonderful panel. Thank you.